My name is Erin Anderson, and I'm the Director of Programs and Advancement for the Autoimmune Hepatitis Association. Joining me today is Veronica Williams, one of the Autoimmune Hepatitis Association's amazing board members and AIH patient herself. She is an incredible champion for patients with our rare disease, and today she's agreed to sit down with me and share more about her personal experience with the disease. Welcome, Veronica.
Thank you, Erin. I'm glad to be here. It's awesome opportunity to tell my story and to hopefully help others who are battling AIH.
Can you tell us how you came to be diagnosed with autoimmune hepatitis?
Yes, so in 2001, I began to feel ill, essentially I just contributed to being in college and working long hours and taking care of small children. I was experiencing like constant heartburn. I was very, very nauseated. And after feeling that way for like several weeks, I began to notice that, my skin was turning yellow, my eyes was turning yellow. So, what everybody usually do is just push through things. So my mother encouraged me to go to the emergency room. She's like, you're not looking so well. You're telling me you're not feeling well. You need to go to the emergency room. So once I arrived at the emergency room, they just started doing a lot of tests. And then I eventually found out that my liver enzymes were elevated. Pretty much they did not know what was wrong with me. They knew that my liver enzymes were elevated, and which was amazing to me. I'm like, how did it get that way? So quickly they admitted me, and I became the star patient because doctors thought my illness was extraordinary. You have to think about 2001 at that time. There was little research about autoimmune hepatitis. And so all the doctors would invite the residents in to talk to me, and like I was a study. So I didn't mind because that's just the type of person I am. So quickly it spread around the hospital that we have this patient with elevated liver enzymes, no explanation. So I felt like a superstar in my own right, but not in a good way. So I stayed in the hospital for 2 weeks until the doctors felt that they had me stabilized. I was on really high doses of prednisone. They then referred me to a gastroenterologist, which essentially he just was treating me for acid reflux, because again, they didn't know what it was. And then sometime later, I ended up going to Strong Hospital in Rochester. I'm originally from Buffalo, New York. And then I used to drive to Cleveland Clinic for treatment because everybody was just essentially clueless. So over a 10-year span, doctors were essentially just treating symptoms until I received my official diagnosis. So to talk a little bit about that, I had moved to the Midwest in 2012. And then once again, I began to feel sick, nauseated, my head was hurting, my chest was hurting. And then my then supervisor, and now close friend, told me that her father was living with cancer, pancreatic cancer, and that he went to a specialist at the IU University Hospital in Indianapolis, and that I should go make an appointment to see if they can help me feel better, because I was feeling really, really bad. So after years of doctors treating symptoms or making me feel like it was essentially, in my head, like, oh no, you just over exaggerating. 3 weeks I was essentially 3 weeks from being in full liver failure. In 2013, I received the official autoimmune hepatitis diagnosis. So that was the short version of how I became diagnosed with autoimmune hepatitis.
Wow, 10 years from symptom onset to diagnosis, and
yes.
Not being listened to, and you mentioned them sharing that they thought it was kind of all in your head. That's just incredible. How did it feel when you finally did receive an official diagnosis?
It was a relief. like finally someone put a name to everything that I was experiencing. And then it became really scary, like really quick, because they were, I tried several different medications that wasn't working. Prednisone essentially destroyed me, like I wasn't sleeping. I had onset of diabetes because of the high doses of prednisone, in which the doctors were afraid to put me on pills because, you know, mostly everything filters through your liver. So I had to take insulin shots. It was a relief, and then it was like very, very scary afterwards because I didn't really know what to expect because of the limited education I had on this rare disease.
And can you tell us more about the symptoms you experienced over that 10-year period as you were working to get a diagnosis?
How I knew that something was going on, I was like very, very tired. I had jaundice was the first indicator that something was going wrong because of my eyes were yellow and my skin turned yellow. So that was the first indication. Like you check boxes when you're sick, like, okay, it's not this, it's not that, and then you self-diagnose. Thank God at the time we didn't have Google. Google wasn't prevalent at that time because Google is not your friend. And I had heartburn. I experienced some neuropathy. And like I said before, I had prednisone-induced diabetes and fatigue. Fatigue was the greatest symptom that I had and still continue to experience to this day. I just, manage it a little bit better.
How can you share more about how you're able to manage the fatigue?
Well, anybody who knows me know I am super high energy. I press through every situation, but I also, allow myself time to just step back and say, you're overwhelming yourself, you're overwhelming your body, and just trying to get rest. Like rest is key. I have my hands in everything on purpose. I like to stay busy. So just, stepping back and really saying to myself, okay, you're tired. You need to lay down. You need to rest. I'm not the type of person to sleep during the day. I'm a morning person. And if you ask certain people, I'm an all-day person. But I just try to, step back and pay attention to when I'm really, really tired. And when I can't press through, I stop.
What medicine do you currently take for your autoimmune hepatitis, and have you experienced any side effects from that medication?
I currently take mycophenolate, CellCept, which 500 milligrams, and I take that medicine twice a day. I've tried other medications when they were trying to diagnose me. I think I took two other medications that didn't work. The ones that start with an A, the ones that's difficult for everybody to say, as a azathioprine. I knew I shouldn't have tried it, but that medication and another medication that didn't work. So my doctor at the time was like very, very good. And he was like, okay, try this for a week. If this doesn't work, we'll try another one. So actually the mycophenolate, funny story is I was turning 40. I was having a big birthday party. I was flying home to New York, and I was, I was in the process of trying different medications. So I felt the day before my party, I was like really, really sick. And I had called the doctor and I'm like, okay, this other medication is not working. And he prescribed mycophenolate the day before my big birthday party. And I woke up feeling like a new person. That medication worked instantly. So I felt like I had a new leap of life. Like, yes, I could do anything because this medication was finally working. I'm not sure. I really didn't have a side effect from that medication. at the time, but over time, I do suffer from anemia, in which I have to take IV infusions if my levels drop too low. And it's been a year since my last treatment, so I'm doing pretty good. But I think that's the, one of the side effects. And then another side effect is of the medicine is limiting your exposure to the sun, because the drug can induce skin cancer. So I was diagnosed with melanoma in September of 2016. And ironically, that was another birthday story. So I was, again, in 2016, flying home to Buffalo. I wasn't having a big party this time. I was just flying home because it was my birthday. And I had went to my primary, like probably like a month prior. And I told him that I seen like a mole. I had a mole on my foot that I was not born with. So I have a series of moles that I know that I was born with, and I can point them out easily. But this particular mole was on my foot, and I'm like, doc, I'm not sure, but does this look odd to you? And he said, I'll just refer you to a dermatologist. So I went to the dermatologist, and I promise you, she checked me over. I showed her, and she was like, I went in the office, and she was like, I'll just cut it off. I'm like, what? Is that your first response, to cut it off? Like, are you serious? She was like, yeah. I was like, okay, got it. So literally, I went to work. I started getting text messages. I started getting phone calls. I'm like, I don't recognize this number. Who is it? So I was driving home, listening to the voicemail. It was the dermatologist. And she pretty much called from her cell phone and said, you need to call me back immediately. And I'm like, oh, this is never good when a doctor call you from their personal cell phone in the evening after hours to say, you need to call me immediately. So when she called back, she said, Veronica, she said it's melanoma, and then she explained what melanoma was, and then she said, we need to go back into your incision and take more tissue out. I was bawling. I was like, oh my God. I said, doctor, do you realize that I'm flying home to New York? She said, I don't care about that. She said, I do not care about that. You need to get in my office. You need to get in my office immediately. So mind you, a week ago, she just went in and removed the mole. A week later, she's telling me that she needs to go in deeper. So long story short, I got the second surgery. She had to do a skin graft, and that's a whole nother funny situation when that process was going down. I may share that at a later time. So essentially, I had to be seen by a dermatologist to make sure that I didn't develop any other melanoma spots. So I have been cleared of melanoma since then. I just have to see her on a regular basis as well.
That's great news. So it sounds like you get regular skin checks because of that experience. Is that?
Yes. Yeah. And I would like to say to people, Black people do get melanoma. So that was, it used to be like my friends would say, Black people don't get melanoma. Everyone gets melanoma.
How are you feeling today with everything?
I would say I'm in a better place. I feel really good. Sometimes, like I said, I suffer like really hardcore bouts of fatigue where, again, I have to listen to my body and rest. But overall, I don't really let autoimmune hepatitis bring me down. I encourage people not to feel sorry for me. And usually I tell people I have autoimmune hepatitis, one, so I can educate them on you can't judge people just by looking at them, what they're going through. I think it's important that I educate others on autoimmune hepatitis, and give people the support, like whatever people's going through, you have to just recognize that everyone is different, everyone copes in different ways, but overall I'm feeling really, really, really good.
How did you learn about the Autoimmune Hepatitis Association?
So if I can recall, let me see, since I was being seen by doctors at IU Health, it was probably likely that I received some type of correspondence from Dr. Lambert. And then I attended the first AIH conference and knew that in some way that I wanted to be involved. It took a couple of years for me to get the courage to be involved. When you came on, I was like, yes, this is my perfect opportunity to just throw myself into the organization and be an advocate for patients, for families, be an advocate for myself.
We've been so fortunate that you agreed to join the Autoimmune Hepatitis Association board and that you continue to be an active volunteer with the organization. What do you enjoy about your role as a board member?
I just enjoy the opportunities to bring awareness to the autoimmune hepatitis disease. Connecting and advocating for patients and families living with AIH and creating programming. So it's very excited to be a part of an organization that supports their patients and supports one another and supports families. So to me, it's all about education, and I'm all about education.
What is the most important thing you've learned about this disease or ways to handle it?
First of all, it's not contagious. People think when you say hepatitis that they automatically call what I say one of the letters. For example, hepatitis A, hepatitis B, C, or D. It is not contagious. It's a rare disorder, liver disorder. And then not all medications or methods will work for anyone. So that's the two most important things that I've learned about the disease. Hearing other patients' stories has really touched me because I realized that, yes, we have the same disease, but it can look different in every individual. How we medicate, how we cope. It just looks different for everyone, and just respecting and recognizing that we are all in this together is like everything. Like just to have that support.
What do you know now that you wish you knew when you were first diagnosed with the disease?
I would say there is hope to live a normal life. Prior to being, like when before being diagnosed, living with symptoms, just treating symptoms, I was scared because I didn't know. But once, like I said, when I found out what the disease was, just planning for the future, we can live normal lives. Well, our normal lives, as long as we take our medication, as long as we're communicating with our doctors. I feel that we are a resilient group of people. Like we will educate, in my experience, the people living with AIH will educate you on what the disease is not. Yes, again, we have our commonalities and symptoms, but we know how to deal with them. And then we just have to take it one day at a time. Individual experience, like I said, individuals experience AIH in different ways.
What advice do you have for other patients?
Don't be afraid to ask your doctor questions. You know your body better than anyone else. And I question everything. And at one point in time, doctor was like, Veronica. I'm like, no, I have to live with this. You're the doctor, but I know my body. I know what will work. Learn how to read your lab work. That's important. Usually I catch things before the doctor catches things because, he has a lot of patience. And If I see something that's abnormal, I will bring it to his attention, and he may order different labs to go deeper. But learn how to read your labs. Make sure your team of doctors communicate with one another and stay up to date on all the treatments. So I think I have like 5 doctors who are up to date on everything that the other doctor is doing. And that's good that they communicate with one another. So usually when I go to the doctor, they say, "Have you talked to your liver specialist?" I'm like, yes, I did. And take it easy on yourself. Try not to question why you have the disease. And I'm preaching to the choir. At times I was saying to myself, why me? Why did I have to be the one diagnosed with the disease? So I've learned to stop saying that and just embrace what I'm going through, and just, again, take it one day at a time.
As we wrap up today, is there anything else you'd like to say or add?
I would say you never know what someone is living with. So get to know them instead of judging them. A lot of people say to me, "You don't look sick." Don't say that. Please don't say that. It's kind of offensive. Not everyone looks sick. And then, I would say everyone out there should help us find a cure, and that you should donate to AIHA today, because it's very beneficial to finding a cure.
Thank you, Veronica. I feel so fortunate that I've had the opportunity to meet you and work with you, and the AIH community is so lucky to have you. Thank you again.
Thank you.